You guys at home have so many good questions about the vaccine, and I got to tell you, I'm learning a lot today from all of them. One thing that people really want to know is, when can kids younger than 12 get the vaccine?
Yeah, it's a great question, and unfortunately, I probably don't have a specific answer. So we know that both Pfizer and Moderna have expanded their trials looking at children ages, I believe, 5 to 11. And so we should know in the next weeks, it may potentially be the next couple of months, of whether or not that's going to be approved again for that emergency use authorization or an expansion of indication. But we should know that in the next, like I said, weeks to a couple of months.
What about people who have allergic reactions to other vaccines, like the flu shot? Is it safe to get the COVID vaccine?
Yeah, so if you've had an anaphylactic reaction to, let's say, the flu vaccine, it's really important to try to not self-diagnose, but actually go in and speak to a provider that was involved with that case, because it really depends on which vaccine we're discussing. There are components that are in influenza vaccines that are actually not in certain ones of the COVID-19 vaccines. So it's really important to actually have that in-depth conversation with your provider, one of your physicians, to really get a determination of whether or not you can receive the vaccine, and if yes, then which vaccine is best suited for you.
Speaking of talking to your provider, this one I imagine is going to be the same answer. Does my pregnant daughter need both vaccines to have her baby at home?
Well, right now we're not forcing patients that have to come in to be vaccinated. All patients are screened for COVID-19. They're asked to wear a mask, patients and visitors throughout their time here. So no, that is not required. If they were to come into Cone Health and be interested in that vaccine, even pregnant women, we are recommending the utilization of the vaccine. And again, that's a conversation that they would have with the OBGYN of timing and what's right for them. But it's not required to come into our facilities, but masking is still required.
Is there any evidence about if a pregnant woman gets the vaccine, does it pass on the immunity to the baby?
We don't have a lot of information around that. There has been, again, a lot of times the way this works is that mothers inherently pass a level of immunity on to their children, that those antibodies that are circulating within the mother find their way to the baby through that kind of birthing process. But right now, there's not a lot of evidence around that. That is something I probably want to defer again to an OBGYN. That gets a little bit out of my specialty once it comes into there. But again, that's something that a good conversation will have. But we know right now that it is still recommended that women seek that vaccine even if they are pregnant. But again, a strong conversation with your OBGYN should clear up any misconceptions there.
Right now, a lot of people across the triad starting to shift back from work to home to in the office. And someone wants to know, should you be tested regularly to work in a close situation like this? And if so, how often?
That's a great question, and I don't have any kind of personal recommendation. That's something that we're discussing right now. Really, the most effective aspect we can do is continue promoting the vaccine. All employers we know will put forward their own guidelines about whether or not they still need to do quarantine protocols, if they're able to adhere 6 feet. Any kind of precautions that are out there, they may still require masks to be worn. Those of us that work in healthcare facilities, we wear masks all day, every day. And so that's going to be something that I don't want to put recommendations out there. Employers will look at guidelines by the CDC and other governing bodies of what's best to utilize going forward.
And finally, someone asked, is COVID getting better or worse?
It's a great question. I think right now, COVID has hung around probably a lot longer than any of us anticipated or wanted. And so we have a lot of effective tools. Right now, we just need people to utilize them. And so we know that the two most effective things that we can do are mask up and then also receive the vaccine. And so from the tools perspective, we are in a really good situation that we have everything we need to protect ourselves and protect our community. Right now, what we're missing is that commitment from everybody in the community to come in, get vaccinated, and to continue wearing those masks if they're put in a situation where they don't feel comfortable or normal precautions aren't able to be met.
Well, thank you so much, sir. I like ending on that sort of glass half full note there. We have the tools, just go get them.